spine. So we'll start spine. Few important topics in spine are: one is basic anatomy. Spine has got the following vertebrae: cervical vertebra, thoracic vertebra, lumbar vertebra, sacral vertebrae, and coccyx. So how many cervical vertebrae are there? Are totally 7 cervical vertebrae. There are totally 12 thoracic vertebrae. There are 5 lumbar vertebrae. There are 5 sacral vertebrae, and there are 4 coccyx. They fuse to form single bone. Okay. So there are these are the bones. Okay. So from the spine you get spinal nerves coming out. So we'll talk about spinal nerves here. Spinal nerves. So when you see about spinal nerves, how many spinal nerves are there? There are 8 cervical spinal nerves, 12 thoracic spinal nerves, 5 lumbar spinal nerves, 5 sacral spinal nerves, but there is only 1 coccyx spinal nerve. So nerves are quantified like this, bones are quantified like this. So don't get confused. If they ask how many cervical spinal nerves are there, you should tell it is 8. Yesterday we saw brachial plexus. How brachial plexus is formed? C5, C6, C7, C8 and T1. So C8 and Vardhalia, so 8 cervical spinal nerves are there. But vertebra only 7 are there. Vertebra only 7 are there. Okay, so this is about the number of vertebrae and the spinal nerves seen in this. One important thing about the vertebra and the spinal cord is, if you consider, these are the lower few vertebrae starting from T12, L1, L2, L3, L4, L5, sacrum and coccyx. Sacrum and coccyx. If you consider these as the lower few vertebrae with the spinous process posteriorly, and the spinal cord here ends at the junction of L1 and L2. Ends at the junction of what? L1 and L2. So at L1 and L2 the spinal cord ends. Clear? So what is the level at which spinal cord ends? L1 L2 junction the spinal cord ends. But from the spinal cord there are a lot of nerves which are coming out. These are called as the spinal nerves. These are called as spinal nerves. These are called as spinal nerves. So after the spinal cord comes out, the bunch of nerves below the spinal cord is called as cauda equina. It's called as cauda equina. It's called as cauda equina. It's called as cauda equina. The spinal cord which is ending like a cone. The spinal cord which is ending like a cone here. Since it ends like a cone, it is called as conus medullaris. 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 Okay. It is called as conus medullaris. So in between the vertebrae, you get a disc. These discs are called as intervertebral disc. These discs are called as intervertebral disc. When you take an intervertebral disc, the intervertebral disc has got 2 parts in it. The outer part is called as annulus fibrosus. The inner part, so the outer part is called as annulus fibrosus. The inner part is called as nucleus pulposus. So this is called as annulus fibrosus, and this is called as nucleus pulposus. Normally, this nucleus pulposus has got lot of water in it. It is more hydrophilic. There's got lot of water in it. In older age, or if you don't keep the spine active, this nucleus pulposus degenerates and comes out. So, if the nucleus pulposus comes out, it can compress the nerve roots. If it comes at a higher level, it can compress the spinal cord also. So this kind of disease is called as intervertebral disc prolapse. Intervertebral disc prolapse. So when a disc prolapse occurs at a very higher level in the central portion, it can cause compression of conus medullaris, resulting in conus medullaris syndrome. If same happens at a lower level, if a disc comes out at a lower level, it compresses the cauda equina, resulting in cauda equina syndrome. What is the difference between these two? Conus medullaris behaves like an upper motor neuron lesion. Cauda equina syndrome begins like a lower motor neuron lesion. Here, ankle reflexes are preserved. Here, ankle reflexes are lost. Here, sacral nerves are involved more than coccyx nerves. Whereas here, lumbar nerves are involved more than sacral nerves, and sacral nerves are involved more than coccyx nerves. So, order slightly changes here. Lumbar nerves are more involved in cauda equina syndrome, whereas sacral nerves are involved more in conus medullaris syndrome. This presents with a symmetrical anesthesia in the perianal region, which is called as saddle anesthesia. Here the anesthesia will be asymmetrical. So these are the differences between conus medullaris syndrome and cauda equina syndrome. Symmetrical anesthesia means, see, if you keep the patient like this, okay, I am putting the patient in lithotomy position. This is this perineal region. This is the anal region. Okay, this is the perineal region and this is the anal region. The anesthesia will be symmetrically around the anal region. This is called as symmetrical anesthesia. On either side of the body, either side of the anus region, there will be anesthesia. But if you take cauda equina syndrome, the patient will have anesthesia like this. The patient will have anesthesia here, so the areas will be asymmetrical. So that is the difference between conus medullaris and cauda equina syndrome. So symmetrical anesthesia is also called as saddle anesthesia. Okay. So this is about intervertebral disc prolapse. Intervertebral disc prolapse are best diagnosed by MRI. Using an MRI, you can diagnose intervertebral disc prolapse accurately. Treatment is, if the disc is in an early stage, you can try analgesics, physiotherapy. If the disc is presenting late, if it is repeatedly, it is causing problem, you can offer surgery for the patient, where they do a procedure called as microdiscectomy. So they remove the disc by using small hole. That is called as microdiscectomy. Microdiscectomy.